All again for coming out to Roar today to learn about some of the great research that's being done at the Arthritis Research Center to empower you all to live well with arthritis. So I am Lindsay Burns, and I'm a research trainee at the Arthritis Research Center. Today I'll be talking about my research on the connection between psoriatic arthritis, but this really pertains to many different types of arthritis, and depression. I'll begin by describing what psoriatic arthritis is, as well as what depression is, and then I'll talk about the link between depression and arthritis, and how depression could have an impact on your physical health and arthritis. And then I'll discuss my own research on mood disorders in the context of psoriatic arthritis. And then I'll sum up with talking about what you can do if you feel like you might have some sort of a mood disorder and you want to be able to combat it and get back to living your life. Psoriatic arthritis, as many of you may already be familiar, is a disease, is a form of arthritis in which your immune system attacks its own skin and joints. And it's linked to psoriasis. In fact, about a third of people with psoriasis later go on to develop psoriatic arthritis. It affects both sexes about equally. And the symptoms of psoriatic arthritis, as you can see with these hands in the bottom here, are pain and swelling, inflammation around the joints, which can lead to disfiguration and dysfunction, as well as nail changes, as you can see in the picture up top here, which can be very itchy and uncomfortable, as well as the signs and symptoms of psoriasis linked to it, which involve scaling of the skin, itchy discomfort, and more inflammation associated with that as well. These diseases have a major impact on quality of life. They're associated with considerable fatigue, not being able to get a good night's sleep, feeling like you're always fighting off a cold, feeling very lack of ability to be able to engage in the activities of daily living that you used to be able to engage in, pain, discomfort, as well as obesity. In fact, a study conducted by another speaker, with a group of us, including another speaker, Dr. Lakai here today, found that people with psoriatic arthritis tend to be more obese than people with rheumatoid arthritis, than people with psoriasis, or people in the general population. So there's a strong link there as well. And the old view is that you can study these diseases in a vacuum, and that these don't affect all the other processes in our body. But what we now know is that psoriatic arthritis is linked to a multitude of other disorders, including heart disease and premature mortality. So what you see when you have psoriatic arthritis and what you feel is pain and swelling in your joints and itchy discomfort around your skin. But what you don't see is that these same sorts of inflammatory processes are actually happening around your inner organs and your heart as well, which can lead to these untoward disease outcomes. And I believe Dr. Lakai will be talking about heart disease and rheumatoid arthritis later today too. Another illness that's been linked to psoriatic arthritis is depression, although we don't know exactly what the extent of that is yet or what impact it might have in psoriatic arthritis, so I'll touch more on that. Depression is the third leading cause of disease burden worldwide, according to the World Health Organization. Canadian estimates suggest that about 12% of us will experience it over the course of our lifetime. Symptoms, in fact, some of the symptoms are very similar to the symptoms you'd experience in arthritis, so it might be hard to decipher, but you can get a loss of interest in your activities that you used to be able to enjoy, inability to experience pleasure, a sense of hopelessness, being stuck in a tunnel that you just can't get out of, low self-worth and self-deprecating thoughts, as well as extreme fatigue and inability to sleep properly. This can be too much sleep or not being able to get to sleep at all. There can also be a sudden increase in weight or decrease in weight or appetite, and you can have trouble thinking or remembering. In addition to all these quality of life problems that can happen in depression, it can also have a major impact in your physical health, and this is especially important in the case of arthritis. A lot of studies have shown that depression is very much linked to inflammation in around the body and the joints in particular. So it could be contributing to the inflammatory state that you're experiencing in your body. Depression also is associated with unhealthy behaviors. So it can lead to a sedentary lifestyle, which you know isn't very good for arthritis, and it can make it difficult for people to take their medications as prescribed. Also, some of the chemicals that get changed in your brain when you have depression also increase your perception of pain. It's actually serotonin is one of the big ones that regulates both pain and mood. And so when one goes wrong, it cascades and starts to affect other parts of your arthritis as well. It also leads to increased obesity, and we know that's a major problem for psoriatic arthritis. And it can lead to untoward disease outcomes in a multitude of other chronic diseases, although it hasn't been studied specifically in psoriatic arthritis. So in the case of cancer, in the case of heart disease, what people find is that depression increases the risk of developing the disease in the first place. It also increases the severity of their disease, and it can increase the risk that they might die of the disease. And so it's having an effect on your physical health as well. And it's also an independent predictor. So just having depression can increase your risk of heart disease and can shorten your lifespan. So what is the connection between the brain and the body that's underlying some of these physical manifestations between the two diseases? Well, depression and anxiety, stress, these sorts of stressful mood states activate something called, and I'll only say this once, your hypothalamic pituitary adrenal axis. And it's just your stress response system. It's something that connects your brain to your body, and there's feedback back and forth between the two of them all the time. So a part of your brain called your hypothalamus regulates your mood, which activates a part of your brain or your pituitary gland, which regulates your hormones, which activates your adrenal gland, think adrenaline. These are things, adrenaline rush is something associated with, having to react in a stressful situation. And so adrenaline actually turns off inflammation. So there are connections going back and forth between the brain and the body, and inflammation connects back to the brain and tells and regulates mood again. So in the case of depression, what happens is this stress response system becomes chronically activated. It's activated all the time. And so there's no more regulation coming from the signals when it comes to controlling inflammation in your body. And your body is no longer able to control the inflammation the way it used to be able to do so. And then coming from the opposite side, if you have inflammation on your body, it can lead to a dysregulation in these pathways that can increase the risk of depression. So we have a vicious cycle where depression can increase your risk of arthritis and inflammation in your joints and your skin. And on the opposite side, this inflammation in your body is increasing your risk of depression. And so the idea is to be able to break this cycle, to be able to reduce the impact on your whole health. And you want to break it at one point, you want to break it at many points. Get rid of the depression, get rid of the inflammation, the more the better. So we've described a theoretical connection between depression and other types of mood disorders and arthritis, but there have only been a few small reports of the connection, and it hasn't been studied really thoroughly in a large population. So we need to know how big of a problem this is, how many people with psoriatic arthritis have depression, and what's the impact of it when it comes to their arthritis. So this brings me to my own research, in which I try to address that question precisely. What I'm doing is using administrative health data, so these are things like birth records, death records, anytime that you go to a hospital, you get a prescription filled, these all generate bills that can be used to find out how our resources are being allocated and used and can help to guide policy. And so I looked at all of the people who had a diagnosis of psoriatic arthritis and was able to identify them all between 1991 and 2006 across the province. And then I looked among those people how many of them had a diagnosis of depression, and then compared their frequency of depression and other types of mood disorders as well to people in the general population without arthritis. And what we found is that there was an increased risk of depression in psoriatic arthritis. Indeed, about 42% of people with psoriatic arthritis had some sort of a mood disorder, had a depressive disorder, an adjustment reaction disorder, or dysthymia. Dysthymia is a sort of chronic state of depression that's a lower level, but it's just experienced over a much longer time. And so there's a whole constellation of mood disorders that seem to be happening and linked to psoriasis and psoriatic arthritis. And specifically, 37% had depression. In the future, what we're going to be looking at is whether depression is contributing, as I've mentioned based on the theory, to this already very high rate of cardiovascular disease and death that we see among patients with psoriatic arthritis. And if this is the case, the next step is to inform policymakers about this gap in care and be able to direct funds toward it, inform physicians, particularly your caring dermatologists and rheumatologists, who will be the ones screening and treating you for your disease, and consumers to be able to recognize the signs and symptoms, screen for it, and actively treat it when you notice the signs and symptoms of depression or a stress and anxiety disorder. If you're feeling stressed and if you're feeling blue and you think that some of these symptoms might pertain to you, rest assured that there are very effective treatments available. And please feel empowered to go and talk to a psychologist or a counselor, your physician, primary health giver, and explain to them what you're experiencing and make sure that you get screened and you get the treatment that you need, not only for your well-being, but also for the sake of your arthritis and taking care of your long-term health. Some of the most common treatments that are prescribed are antidepressant medications, which can be good for mild to moderates, or up to moderate to severe depression. Sunlight or a sight light box can have many of the same effects of an antidepressant medication by using cues that will trigger the same sort of chemicals in your brain to be produced naturally. As does cognitive behavioral therapy work just as well as antidepressant medications. It's just as effective in mild to moderate depression. And group and support services are available throughout Vancouver and the Lower Mainland that are a wonderful resource and can really improve your mood, get you going, and just be able to relate to other people with the condition, which also greatly improves outcomes. And the main theme of my talk, in the mood to move, one of the best things you can do to improve your mood, improve fatigue, get a better night's sleep, reduce weight, take the weight off your joints, to reduce pain, and a whole medley of wonderful benefits is exercise, especially as I've shown in the picture here, non-weight bearing exercises such as pool therapy, aquasize classes are really fantastic ways to not put extra stress on your joint, but still have a lot of the benefits associated with exercise. So I'd like to thank you all for listening here today and welcome you to answer, or I'd be happy to answer any questions that you have.